Hi, Mr. Smith. I'm Dr. Kemka. Can you
Hi.
see and hear me okay?
Yes.
Just to confirm you're in a safe and private location.
Yes. Yes, I am.
So we're going to be doing this visit via telemedicine. Are you familiar with the concept for telemedicine?
Yeah, I've done it a couple of times. I'm familiar. Yeah.
Okay. Are you okay to consent to a telemedicine visit today?
Yes.
Great. Who do you have with you today?
This is Lori. She helps take care of me.
Hi.
Hello, welcome. So are you okay if Lori is here with you today during this visit?
Yes.
Okay, great.
Notice the introduction of a caregiver. This is the first time that we're seeing someone in the room with the patient. Notice how you can see both of the people on the screen at any given time. Make sure that you practice this beforehand so you know how to position the room. Also notice that the provider acknowledged the caregiver, got the name of the caregiver and who the person was, and that the patient was comfortable with the caregiver being there and present during the entire visit.
I see that you're having some issues with chest discomfort. Can you tell me a little bit more about that?
Yeah. It just I've noticed that like when I exert myself, like if I walk up a flight of stairs or something like that, I feel this kind of pressure and tightness, this pain in my chest, and it usually just goes away if I rest or sit down. Just kind of goes away on its own.
Okay,
Uh, but when I'm sitting normally, like right now, it doesn't hurt.
okay. How long has this been going on for?
Oh, probably a couple of months now.
Okay. And do you feel like it's increasing in severity or how long it's lasting there?
No, it's been about the same. It's just kind of these episodes that I've noticed.
Oh.
Yeah,
Do you usually do anything to try to help alleviate the pain?
I usually just stop what I'm doing and
Okay.
rest.
And can you predict when it's going to come on?
Um, not not really, except for if I do something too physical or
Okay.
uh, heart rate up.
Okay. So Mr. Smith, can you tell me, do you have a history of high blood pressure or high cholesterol?
Not that I know of.
Okay. Do you take any medicines regularly?
No,
Okay. Do you use tobacco?
I do smoke. Yes.
How long have you smoked for?
Oh, um, probably 20 years now.
Okay. And how much do you smoke on a given day?
Oh, it depends. Somewhere usually between half a pack to a pack a day. Yeah.
Okay. And do you use any e-cigarettes or vaping?
No, nothing like that. No.
Okay. And have you ever quit before or any thoughts of quitting now?
Uh, I've thought about it for sure. It's just so difficult. I mean, I know it's not the best health
Sure.
wise, and
Notice how the provider takes the history on the tobacco use. It's important to know how much the patient is smoking, how often they're smoking, the amount they're smoking, and notice that the provider asked the patient if he was ready to quit at that time. This is an important social determinant of health to capture during a telemedicine visit.
Do you mind telling me a little bit more about your living environment? Like, is there a lot of dust in the house, pets at home, that kind of stuff?
yeah. I mean, my house isn't the cleanest. I don't I don't really dust very often, so I'm sure there's dust floating around. I have a few cats, so I'm sure there's some pet dander um, around. Yeah, I know I should probably clean a lot more often than I do. It's just finding the time and or hiring somebody to come and clean. I don't really have the money for that, but yeah, I'm sure there's dust or cat hair around. Just
Yeah.
Note how the provider asked the patient about his home environment. He asked him about various social determinants of health. Do you have a clean home? Do you have money to be able to have somebody clean your home? Are there things within your home environment that could be exacerbating your asthma? Telemedicine gives you a window inside that patient's home. You're able to see if the home is dusty. You can see if there are pets around or different things that might be exacerbating chronic conditions. The provider takes note of that and incorporates it into the visit and the treatment plan.
Let's move on to your physical exam. I understand that you took some vitals before this visit. Can we go over those?
Sure. Yeah, I took my blood pressure and it seemed okay. It was about 120/80.
That's great. And how about your temperature?
We did take that with this Tido device, and it was normal. It was about
Oh,
90.
great. Okay. I'm going to walk you through the physical exam with the help of your caregiver here. I know that you have that Tido peripheral device as well to help me hear your heart and your lung sounds. So I want to look at your respiratory rate to start with. If you could, just put your hand over your chest, and I'm going to count how many breaths you take.
Okay.
So over about 15 seconds, you took about 3 breaths. So that's roughly 12 breaths per minute.
Okay.
I'm going to have you take your pulse now. Can you place 2 fingers at the base of your thumb until you can feel your heartbeat? I don't know if you can see that right there.
Okay.
And can you feel your pulse?
Yeah.
Okay, great. So I want you to, so I'm going to count to 10, and then I want you to just tell me how many times you felt your heartbeat. Let me know when you're ready to start.
Okay.
Okay. All right, so that was 10 seconds.
11.
Okay, so your heart rate's around 66 beats per minute, which is great.
Okay.
So now just by observing you, I don't get the sense that you're really short of breath or uncomfortable during this visit. Is that correct?
Yeah, I feel okay.
Okay.
Yeah, the next thing I'm going to do is just have you repeat a sentence after me. Obviously, we've been talking, and I've seen that you're speaking in full, complete sentences. But just for the purposes of the exam, if you'll just repeat after me. So, can you repeat, "Oh, say, can you see by the dawn's early light"?
Oh, say, can you see by the dawn's early light?
Okay, good. So as you notice, you didn't have to stop and take a breath, so that's good. Patients with severe uncontrolled asthma that I'm worried about, they can't even make it through that whole sentence without having to take a breath.
Okay.
So that's reassuring to me.
And then can you point with one finger where your where your pain is when you're having your chest discomfort?
Oh, it's just right in the center here.
Okay.
Yeah.
And does
But
it go anywhere else into your jaw or your arm or your back?
No, it's just straight right there. Yeah.
Okay. So I'd like you to push on that area. Can you tell me if you have pain when you do this? And push somewhat firmly.
Okay.
And does that recreate that pain that you've been having?
No.
Okay. And if you go to the side, so you have your breastbone or your sternum right here, can you go to the side of it and just push along the side of that on both sides? And again, firmly, and tell me if that recreates any of the pain that you've been feeling.
No, it just feels like push.
Great. So it doesn't appear to me that you seem very pale. Can I see your fingertips?
Sure.
To the camera.
The front and back.
Okay. Yeah. They look pretty normal to me. Great. I'd like to see your legs to look for swelling. Can you show me your legs with the sock line?
Okay. You want me to? I guess I can stand up.
Put your foot in.
Oh, that's great.
Perfect.
Okay. And yeah, and then can you take a finger and just push down and let's see if it makes an indent? Okay, that looks pretty normal. Great. Thank you. Last, I'm going to listen to your heart and lung sounds. So if your caregiver can help us put that device on your chest and your back, that would be great.
Okay.
Okay, looks like it's loading the heart exam. Okay, so as you can see, it's kind of telling me where to position the device. And
Okay,
so
great.
go
Let's
ahead and
try that.
like on the right side of the chest. There.
So I'm hearing normal heart sounds through that Tyto app.
Perfect.
And so now let's listen to your lung sounds. Would
Okay.
you mind taking your sweatshirt off for me?
Sure.
Just so make it a little bit less dense in terms of the clothing.
I just clicked on the lung exam
Okay, great.
and it's showing me kind of on the back
Mhm.
where to the device.
Yeah,
So
that's
I'll,
exactly right. Let's try that.
it says just to take some deep breaths.
Try to take some deep breaths through your mouth if you could. And let's move to the next position.
Are those coming through on your side? Okay.
Yeah, they sound great.
Excellent recording.
This is the first time that we are introducing a peripheral device to a telemedicine visit. This allows the provider to listen to other things on the exam. The provider can listen to the heart exam or the lung exam, can do a skin exam, can do an ear exam. These things can be done asynchronously, where the patient and the caregiver does the exam prior to the visit, uploads it, and the provider reviews it prior to the visit, or it can be done synchronously when the provider is listening during the exam real time.
So your heart and your lung sounds both sound normal to me.
Okay.
Let's do these things. So I think you have what we call stable angina. So you have some blockage in your heart, but your heart is adapting to it so that when you're at rest, you're not having very many symptoms. But if you're pushing yourself, you are. This is something that we can treat medically with some medicines without needing any procedures. And I don't think you need to go to the hospital or to the ER. We would just watch you closely and make sure things are stable, and make sure that your symptoms are controlled so that you're able to do what you need to do and what you want to do. What questions do you have for me right now?
Can't really think of anything. I feel like you covered it. I just want to get better, and I'll do whatever I need to
Okay.
with what. Yeah.
Yeah, so that sounds great. Definitely keep in touch with us if there's any concerns. And one of the things to definitely think about is quitting smoking. That will be a big piece of this to try to help you feel better. All right.
Yeah.
It was good to see you, Mr. Smith,
Thank you.
and your caregiver. Thank you, guys.